If there is even the slightest suspicion of any chest pain, unexplained uneasiness, please contact your cardiologist. The data says that broadly speaking, 30% of the patients they do not even reach hospital. गैस अगर बर्निंग किसी को हो रही है, unexplained uneasiness हो रही है, swelling हो रही है, लेफ्ट आर्म में पेन आ रहा है, तो उसको आप डिस्पोज ऑफ ना करें. But we see the tip of the iceberg. What is happening inside? It is not very clear. There are certain hidden kind of stimulants or some villains, cholesterol, diabetes. These are all other villains. Smoking exactly does the same thing as the COVID does.
Hi, I'm Shreyasa Vijay and you're watching Ritam. A strong and healthy heart is the key to long and happy life. But unfortunately, what we are seeing today that more and more people are suffering from heart conditions and heart attacks have become a widespread issue across the world, especially in India. So, to take care of our heart has become more imperative than ever, as it is one of the leading causes of death in our country. But the question is, how do we do that? And to guide us on that, today we have with us Dr. Vivek Mittal, who is a heart specialist and is currently working at Metro Hospital and Cancer Institute, New Delhi. Thank you so much, sir, for joining us.
Hi, thank you so much.
So my first question to you is that there are people suffering from several heart diseases, but we often just talk about heart attacks. So what do you think will be the best way to guide people through that in a simpler form, what heart diseases is?
Right. So I will tell in mixed way kind of thing.
Okay.
See, the people with heart attacks, the problem has occurred for the last few months or few years, I must say. An important thing is that our young generation, they are being affected severely, and it's very unfortunate when the patient lands up in our hospital or some other hospitals. The most of their heart muscles are damaged by the time. So it is of paramount importance that the people they recognize their heart attack symptoms, which is often missed. होता क्या है बेसिकली, जैसे किसी पेशेंट को गैस हुई, घबराहट हुई, तो उन्होंने अपने जस्ट सिम्टोमेटिक मेडिसिन अपने फैमिली फिजिशियन से आपस में केमिस्ट से पूछ के उन्होंने उसको सॉर्ट आउट किया, एंड दे जस्ट फॉरगेट अबाउट इट कि ओके इट वाज जस्ट ए माइनर काइंड ऑफ gas attack or something like that. So actually it is not that. In fact, just in the last 1 month or so, I have done angioplasties of 3 patients who were in the age group of 25 to 35 years.
Okay.
Right? And they were their parents, so I must say that their family friends, they were intelligent enough to recognize the symptoms and raise the alarm. So the patient came to us and we did it. And that's why I want to emphasize to our public that the symptoms of heart attack, like heart burning, something like gas, acidity, ये चीजें पहचान नहीं आनी चाहिए. और इसके क्योंकि आजकल कोई एज पार नहीं रहा है. जब हम लोग पढ़ते थे तो उस समय ये था कि 40, 45, 50 इयर्स की डिजीज है और यंग जनरेशन में तो कुछ नहीं, आपको जस्ट रिलैक्स रहना है, जो भी खाओ पियो. अभी ऐसा नहीं हुआ है. सो गैस अगर बर्निंग किसी को हो रही है, अनएक्सप्लेन्ड अनइजीनेस हो रही है, स्वेटिंग हो रही है, लेफ्ट आर्म में पेन आ रहा है, तो उसको आप डिस्पोज ऑफ ना करें. आप अपने फिजिशियन से या किसी नियर बाई हॉस्पिटल में जाके ईसीजी कराएं और ब्लड प्रेशर चेक कराएं, और उसके अकॉर्डिंगली, जिससे कि टाइमली एक्शन लिया जा सके, कोई कैटास्ट्रॉफी को हम अवॉइड कर सकें.
So, जैसे आप बात करें कि यंगस्टर्स में भी आजकल ये प्रॉब्लम बहुत ज्यादा देखने को मिल रही है, तो अर्लियर देयर वाज अ परसेप्शन कि इट इज समथिंग दैट जनरली अफेक्ट ओल्डर पीपल, एंड इफ पीपल इन देयर 20s and 30s generally think that if we'll get to that age, then only we'll take care of our heart and all. So why do you think this pattern has changed?
See, there are 2 or 3 facets in this. First of all, the lifestyle.
Okay.
The lifestyle for our youngsters have changed drastically. There are a lot of things available. They are not doing any sort of physical exercise. They just kind of binge upon the meals like fast foods, which are always available for youngsters, and they do not do exercises also. Nowadays, things are not there. Even the COVID times, when everybody got isolated, they are just at their homes and playing with the gadgets available. So it adds to the calories, it adds to the bad fat inside the body, and that's why it's choking up. Is second facet is that we are now coming up with a lot of diagnostic modalities which were not earlier. For example, CT coronary angiography, treadmill test, echocardiography in advanced form, 3-dimensional echocardiography, and calcium scoring also. So people,
these kind of tests.
yeah, these are the kind of tests. So people, they are now become more aware. For example, if their family history is there, their first degree relatives, they have undergone some sort of cardiac surgeries in the past, so they are quite aware, because their doctors often tell them, okay, because your family history is very strong, so please to get these tests, they hardly require any admission. They can be done within few minutes to hours.
Okay.
So these are the kind of tests. They detect the heart disease at the earliest, so that patient can take timely sort of advice from their doctors to go for intervention. So these are the two facets which I want to emphasize, that the youngsters are now becoming more prone, and because of diagnostic modalities also which have come up very fast in the recent times, maybe a decade or half or so. An important thing is that apart from genes, it is the environmental kind of modification which have come up, because you see a lot of pollution have come up in this Delhi NCR area and other areas adjoining this also. So this, and the air pollution. So these are the things which are putting a lot of stress upon your body, upon your blood vessels. And when there is any kind of stress going up to your body and your heart and your blood vessels, they take up a heavy toll, and that's why it leads to the choking or clogging of arteries, what you call, and thus leading to heart attack. So yes, genes, and more than that, environmental factors.
What kind of environmental factors?
Environmental factors, as I told, the pollution,
Okay.
and stress levels, stress, whether physical stress, whether mental stress, and because professional kind of stresses, unemployment, these have come up, and these our youngsters are putting up, they are taking up a big toll upon their body, and that's why we are getting a lot of strokes and a lot of heart attacks at this particular age group. I don't know over next few years or so what will happen because of these kind of stresses. Less work, more stress.
So you mentioned the term stroke.
Yeah.
We often hear terms like stroke, heart diseases, or cardiovascular diseases. So what's the difference in these terms?
See, what this entirely being encompassed in the what you say cardiovascular continuum, or you can say vascular disease. When you talk about vascular disease, it means the arteries of the brain which is choked, that causes stroke, and the arteries of the heart, which means it causes heart attack, arteries of the kidneys and limbs respectively. So this is entirely comes under atherosclerotic vascular disease. Atherosclerotic means choking or blockages inside the arteries, building up of the plaque, and the vascular is blood vessels. So whenever the blood vessels, talk about the blood vessels, it includes the blood vessels of the heart, blood vessels of the brain, blood vessels of the eyes, and thereafter leading to the consequences like heart attack, brain attack, and you might have heard of sudden loss of vision in the eyes because of vascular involvement, because the arteries are everywhere inside your viscera, whether be it retina, be it heart, be it neck, or be it brain.
So you talk arteries के blockage की बात कर रहे हैं. So I was reading somewhere that this does not happen suddenly. It takes time. Like over the years, it happens.
Yes, of course. See, this it's a very good question. The atherosclerotic vascular disease, actually it develops in predisposed individual in itself in the first or second decade of life.
Okay.
So it progresses over a period of 10, 15, or 20 years depending upon the individual kind of propensity. And whenever there is some kind of stress, I mean not only physical stress, but there is some kind of mental stress also. And this stress sometimes lead to the release of chemicals inside the blood vessels, which lead to rupture of the plaque which was developing inside the arteries. So there is a rupture of fissuring of the plaque inside the, for example, in the arteries of the heart, and because of that rupture, there is a continuum of formation of more and more clot, and there are some chemicals which are being drawn from the blood, which lead up to choking of the arteries. Finally, the blood is being hampered from going to going to the various areas of the heart and leading to heart attack. This is the process which takes 10 to 25 years, and every individual has got the propensity to develop it or not. Sometimes you feel that 80 years old healthy guy is fit enough. We did the angiography of a guy just yesterday only. He's 80, is perfectly fine. And sometimes you see 20 to 40 years of person, they are having a lot of blockage inside the arteries.
Exactly, yeah. So how should one determine if their heart is truly healthy or not? What kind of tests do you recommend to your patients generally?
We must kind of modify nowadays that every individual who is, even for adolescent persons also, like 16, 18 years old young boys or girls, they should go annually, at least if not 6 monthly tests for ECG, blood test, checking up your lipid profile, in which the bad cholesterol and good cholesterol, they are being measured, and sugar levels. If the patient has got family history of premature heart disease, right? Premature heart disease means in the males it is less than 60 years, in the female it is approximately less than 55 to 60 years or so. So these tests should be done regularly. And sometimes if the patients have got history of any chest pain, any discomfort, or blood pressure, or certain other risk factors are there, these tests should also be done in these type of patients at an earlier stage, like ECG, echocardiography, lipid profile, sugars, kidney function tests. As I told, certain inflammatory markers like homocysteine levels, HSCRP. So there is a quite a plethora of tests which can at least detect that the particular individual at risk of heart disease, though we just can't predict which will develop heart disease. Sometimes, we come across a lot of patients. Doctor, I think 1 month back we got all the tests done, treadmill test and echo and everything was normal. In our inflammatory marker and lipids are normal. How did we get this heart attack?
Exactly.
So it is, we are the tip of the iceberg. What we see is the tip of the iceberg. What is happening inside, which is not very clear. There are certain hidden kind of stimulants or some, villains which are playing a role in creating the inflammation inside the vasculature. If there is even the slightest suspicion of any chest pain, unexplained uneasiness, or any, for example, any athletic person, if he or she is doing some kind of exercises without any discomfort at an earlier stage, if he or she develops that kind of discomfort, please contact your cardiologist or physician and or primary family physician and get your test done. Every individual should be sensitized enough to take a call early when alarming symptoms develops. If a sedentary person is there, for example, right, he or she does just going to washroom, do 50-100 meters of walk. If he or she develops some kind of pain inside the chest, some palpitation, heartbeat बढ़ना, डॉक्टर साहब मेरे heartbeat काफी बढ़े आती है, पहले ऐसा नहीं होता था. और for that matter, as I told, athlete जिसको तेज चलने पे पहले नहीं प्रॉब्लम होती थी, अब उसको प्रॉब्लम होती है, because you might have heard in the history also some fit person, they died suddenly.
Exactly. Yes.
So right. So this is the thing. These are the kind of persons. These are the symptoms which one should not ignore. Now we have got a very beautiful test, CT coronary angiography. Even sometimes, educated staff or those anxious patients, they do request us, doctor, CT angiography करा दो हमारा, प्लीज हमें इस चीज से बाहर निकालो, TMT को तो सब सही आते हैं, आप प्लीज ये करा दो. So it's okay. I mean, though it's not come under major recommendation, but yes, so we kind of suggest these things. Okay, आप CT angiography करा लीजिए. तो उसके बाद में there is a peace of mind. We see a lot of stress goes away. कि कोविड के बाद में हमारे blockages बहुत आ गए हैं.
Exactly. There was a study by ICMR that there's a rise in heart attacks in Indian population after getting infected by COVID and even the COVID vaccine. So what do you say about that?
Yes, see, there are some in medical science always there are gray areas, no black and white. There's a one school of thought is that post COVID, not because of vaccine, post COVID also there is increase in the coagulability, thickness, thrombogenicity, which is being developed. There are a lot of funny things which I have come across sometimes, and even after COVID vaccine, that may be related to COVID vaccine or related to the COVID infection. There's some increase in the thrombogenicity, means thickness of the blood has increased, some inflammatory markers have increased, which we used to see, whenever the patients were admitted, HSCRP, interleukins. So these are all are bad things which should not be there inside the blood, and these kind of damages your blood vessels. So as I told earlier, whenever there is a damage to the lining of the blood vessels, there is clot developing, which is the biggest villain in creating the heart attack. So these are the ways because of COVID. These are the reasons vascularity, vascular integrity is being compromised, leading to clot formation and leading to heart attack. One thing we can take it after COVID, there's a lot of adverse effects upon the immunity. बीमारी से लड़ने की क्षमता in India, to be precise. So that has been developed, and because of decreased immunity, all the people, most of the persons who had COVID, they have gone more prone for infections, like more prone for respiratory infections, जो आजकल इन्फ्लुएंजा, जुकाम, खांसी टाइप का है. Every third fourth patient is complaining on like that. डॉक्टर साहब उसकी दवाई हमें लिख देना, हम बाहर जा रहे हैं, उसकी पहले से ही लिख देना, हम बाहर जा रहे हैं.
So how does sugar, diabetes, or any other cholesterol levels or any other such disease affect heart health?
Cholesterol, diabetes, these are all other villains. These are the precipitating factors for causing choking inside the arteries of the heart. Simple. And they release inflammatory markers also. So these together, these type of person, these are the risk factors. What we say, risk factors precipitating factors which are there, and these type of persons have got more propensity for blockages inside the arteries by causing vascular inflammation. Important thing again, blood pressure. If you take a 100 meters area, there are a lot of, I think, 100 patients, 100 persons are there. They are not, I think 50% of them will not be, they won't be aware of their blood pressure.
Okay.
So important thing is that it is the level of every masses should be informed well that they should take their blood pressure, they should take their sugar levels, because they are not aware of it. Those who are aware of it, they are not having good medicines. Those who are taking medicines, they are having inadequate medicines. So they have to diagnose their problem like
Okay.
blood pressure, sugar and cholesterol with the help of doctors or tests.
Hmm.
They have to kind of start the treatment in an appropriate way, and they have to optimize the medicine, because if you optimize or if you appropriately control your blood pressure, sugar, cholesterol, there are lesser chances as compared to other persons of the same age group who are having these problems and they are not being controlled. So
Okay.
you have to control it, because you just can't have a control upon that कि किस आदमी को ब्लड प्रेशर ना हो, इसको डायबिटीज ना हो. दैट इज अ जेनेटिक काइंड ऑफ थिंग, वो जिसको है
अगर
उसको
जीन्स में
होना ही
फैमिली हिस्ट्री है तो
है
होगा ही
होगा. बस
Okay.
उसको कंट्रोल, आपके जो आपके हाथ में है
हाँ
उसको
जी.
कंट्रोल करना है.
If my parents have sugar and cholesterol and blood pressure, so am I at risk of getting those diseases or even heart attacks?
Yes, of course.
Okay.
And especially females after 45, 50 years of age, after the menopause is attained, those who have got family history of heart disease, definitely they are prone for it.
Okay.
And they should be maintaining healthy lifestyle. And for male persons, age is no bar, trust me.
Acha, okay.
Yeah.
So is there any difference between male and female symptoms of heart attacks?
In females, what happens, which I practically noticed and also written in literature, female patients often may not complain of that much classical chest pain as compared to their male counterparts.
Okay.
They sometimes will say, because most of the females in our community overall, they are housewives or maybe working wife also. So they tend to kind of disregard it. Okay, गैस आ गई होगी, दवाई ले लेंगे. So they are
Generally
not,
avoid
they are
treatment.
generally they're avoiding, they are little bit kind of, you can say, careless about it. And वो होता है ना कि they eat less and last. So in the family, the typical female. So even working also, they are not very much aware of it. They do not want to seek medical attention at the earliest until unless their male family members, they insist. Classical chest pain do not occur in females. They often complain of uneasiness, breathlessness, and some gases sensation. I've come across a lot of patients. Excessive sweating, घबराहट. These are the kind of things. These more commonly occur in female as compared to males.
Okay, you were talking about importance of physical exercise and workout. अगर हम 2023 और 2022 में देखें तो हमने बहुत सारे ऐसे केसेस देखे थे जिसमें सेलिब्रिटीज और इवन फिटनेस ट्रेनर्स were collapsing in the gym due to heart attacks.
Yes.
So, and they were apparently they were very cautious and they had a very healthy routine and everything. So, what's the reason behind that?
Again, they must be having some kind of genetic predisposition for it. See, those patients who died suddenly, because apart from heart disease is a broad term. It means the blockages inside the artery is one.
Okay.
Because until unless you do angiography, you can't say. Second is another disease, sometimes until unless you do it before, the patient gets this catastrophe, like hypertrophic cardiomyopathy. So cardiomyopathy is just a heart muscle disorder in which the heart thickens quite significantly as compared to normal persons, so that it kind of obstructs the flow of blood outside to different parts of the body, because heart is the engine of the body. Okay. So it is not able to pump the blood to various parts of the body effectively. So patient can have sudden cardiac death in these type of cases, especially in athlete you've come across, if you've taken up the history. So it is being shown there. So that can only be possible either in postmortem or before that. If echocardiography is a simple test, although other advanced tests are there like cardiac MRI and CT scan, as I told earlier also. So these are the things which might have occurred in this kind of patient. Again, coronary artery disease is the most common cause of sudden cardiac death, especially in male age group.
Okay. अगर हमारे घर में किसी को हार्ट अटैक आता है, हमारे सामने somebody collapses in office or while traveling, so what should be the first course of action?
Yeah, see, उसमें basically आपको emergency number dial करना ही होगा.
Okay.
और somebody, those एजुकेटेड या इसलिए हम लोग सोसाइटी में जो कार्डियोपल्मोनरी रिससिटेशन का जो प्रोग्राम्स बताते हैं जो अलग अलग हॉस्पिटल से ऑर्गेनाइज होता है, तो उसमें हमें पब्लिक को या सोसाइटी में उनको ट्रेन करना चाहिए। तो क्योंकि इमीडिएट जैसे आपने बताया ये अल्टीमेट कैटास्ट्रॉफी है जिसमें आपको शायद एम्बुलेंस बुलाने का भी टाइम नहीं मिलेगा। तो
हाँ,
सीपीआर वन शुड, अगर आप फॉर्चुनेट अनफ हैं आपके नियर बाई या फैमिली मेंबर्स या नियर बाई पड़ोस में सीपीआर जो अच्छी तरह करना चाहते हैं कार्डियोपल्मोनरी रिससिटेशन, उससे आप कर सकते हैं। और अगर पेशेंट कॉन्शियस है और हार्ट अटैक का सिम्टम्स है तो आपको पेशेंट को डिस्पिन की एक गोली देना चाहिए और फिर तुरंत इमरजेंसी नंबर कॉल करके उसको एम्बुलेंस में लेके आना चाहिए, बिकॉज उसमें टाइम इज वेरी इंपॉर्टेंट। बिकॉज इन मैसिव हार्ट अटैक्स data says that broadly speaking 30% of the patients they do not even reach hospital, or when they reach hospital they die within 30 minutes or so.
Yes. फूड एंड न्यूट्रिशन में किस तरीके से अफेक्ट करता है हमारी हार्ट हेल्थ को, एंड हमें उसको कैसे बेहतर बना सकते हैं?
फूड एंड न्यूट्रिशन में मैं ये कहना चाहूंगा कि बेसिकली आपको हार्ट हेल्दी डाइट लेना चाहिए, हाई फाइबर डाइट, लो फैट, लो कार्ब्स, लो कोलेस्ट्रॉल, बट हाई मॉडरेट टू हाई प्रोटीन्स। जैसे जो लोग वेजिटेरियंस हैं उनके लिए सिंपल, जैसे पनीर हो गया, चोफा वली हो गई, सोयाबीन्स हो गई, पल्सेस हो गई, दाल, हरी सब्जियां, ग्रीन वेजिटेबल्स, ऑल दोज, मिल्क, स्किम्ड मिल्क हो गए, ये बेसिकली लेना चाहिए। और जो लोग नॉन वेजिटेरियन हैं वो लोग रेड मीट को अवॉइड करें। और दिस दे शुड बी मोर ऑफ द fibers, legumes, this is of paramount importance. And when the sun sets, after the sunset, carbs and fat should be cut to the minimum, because there are a lot of negative effects in the body when you take a lot of carbs, junk foods, or the party times and all those things. You see that sab night mein hi hota hai. That's why it is of very much importance that after sunset you cut down your carbs, fats to a great extent, substitute with proteins.
So alcohol and smoking, does that increase the risk of heart attacks?
Yes, of course. Smoking exactly does the same thing as the COVID did. So, right, smoking again increases the inflammatory markers, choke up the blood vessels, causes vasoconstriction, means the constriction of the blood vessels. And alcohol is actually, there are two modes kind of thing. If you are a casual drinker or maybe one or two drinks in a week, that is okay if you are not a liver patient. But you take too much of alcohol, for example 2 to 3 packs in a day, that is going to compromise your heart health, that is going to increase your blood pressure, and that may cause other problems also which are more dangerous as compared to heart disease, especially if you take alcohol, like liver disease, liver cirrhosis. You heard of it? Liver cirrhosis and stomach problem, intestine problem, irritable bowel syndrome, and some psychiatric disorders. So alcohol should be modest and smoking should be zero. That is my.
There's no safe quantity.
No.
Okay. आजकल सब कोई फिटनेस वॉचेस भी पहनता है, तो उसमें हार्ट रेट कितना होना चाहिए जनरली?
Yeah, see, whenever you say a fit person, it means his or her heart rate should be as low as possible, between the range of 60 to 80. The person who is having a heart rate without medication, I mean, 60 to 80, he or she is more fit than the heart rate of more than 80 to 100. It means his conditioning of the heart is very good. And this is another thing I've seen, that the watches which are coming up, they are putting a lot of anxiety to our youngsters or patients. डॉक्टर साहब मेरा हार्ट रेट इतना आया, डॉक्टर साहब मेरा ये इतना आया, समथिंग, मैंने कि ईसीजी कर लेते हैं पेशेंट से, ईसीजी तो इसी में आता है, so there are a lot of things they are misguiding kind of thing. But yes, it's okay. I mean, if somebody is aware, they want to have a knowledge of the calories, they want to have a knowledge of heart rate, that's fine. For example, if heart rate is getting too much, somebody is exercising, is crossing 150, 160, then it's a good tool.
So what kind of exercise would you suggest to people? What's better? Is yoga, cardiovascular exercises, or strength training?
Combination of all.
Okay.
I must say it, because everybody can do strength training, and hypertensive patients, they should start. Yoga is always better, best of all. But I would recommend, depending upon the patient's agility, his fitness, his age, that combination of yoga and aerobic exercise. These are cardio and aerobic exercises. There are various forms of this, either in the form of cross trainer or treadmill, or cross this one, what you say, Jumbas, and these kind of things, they can be taken up. And it is very good for maintaining the cardiovascular fitness, even if one is not hitting up the strength training exercises, those should be done at least twice a week. Recommendation is that
Strength training.
strength
Okay,
training,
okay.
at least if somebody can do it. Otherwise, yoga should be done almost all the days.
Okay.
The recommendation is that you should do 150 minutes of moderate intensity exercises every week. But if somebody is, 20, 30 years of age, he or she can do much better. So it should be done. But depending upon the age group, as I told, and fitness level and cardiovascular disease, so he or she can kind of modify it, but it should be at least 40 to 45 minutes of moderate intensity exercises, preferably aerobics, as I told, plus yoga. So it's a combination of every modality has got its own advantages, and it cuts down your visceral fat, it's cut down your vascular disease and the chances of sudden heart attacks, which we were discussing about. It is also being found that those persons who take these kind of exercises regularly, they have got less chances of sudden cardiac death as compared to others who do not do it at all, leading a sedentary lifestyle. If somebody is obese and he or she is doing exercises, even if he is not or she is not losing weight, as compared to other person who is obese and not doing exercises, वेट रिड्यूस तो उसमें होगा ही नहीं, उसमें रिस्क कम होगा जो एक्टिविटी करता है. यस, वो उसके मुकाबले रिस्क उनमें कम होगा. तो इट्स वेरी इंपॉर्टेंट. समबडी गेट फ्रस्ट्रेटेड, हो यार हमारा तो वेट ही कम नहीं हो रहा, डॉक्टर ने ये एक्सरसाइज बता दी, जितना वेट था उतना का उतना है और कोई फायदा नहीं, छोड़ो यार इसको. तो दैट काइंड ऑफ थिंग शुड नॉट बी देयर because it's a long standing process and it had got its own advantages. Activity level should be there because it increases the metabolic rate. Whenever the metabolism increases, your body is well conditioned for not getting heart attacks and all. हमने कई बार farmers को उनका किया है angioplasty. They are more fit, more motivated and less depressed as compared to our urban counterparts. They are less fit, more depressed.
ये किस तरीके से अफेक्ट करते हैं हार्ट हेल्थ को, वेदर इट इज डिप्रेशन, एंजाइटी? बिकॉज एंजाइटी में भी हमें सिमिलर सिम्टम्स देखने को मिलते हैं, जैसे आप चेस्ट पेन्स की बात कर रहे थे, घबराहट की बात कर रहे थे.
जैसे एंजाइटी और स्ट्रेस के पेशेंट्स होते हैं, उनमें हम अक्सर कई बार देखते हैं ईसीजीज, ब्लड प्रेशर, कार्डियक मार्कर्स, हार्ट रेट उतने बड़े नहीं होते. कई बार एंजाइटी में मिल सकते हैं, आउट ऑफ प्रोपोर्शन नहीं होंगे. कार्डियक इलनेस, हार्ट अटैक वाले पेशेंट्स में ये पैरामीटर्स आउट ऑफ प्रोपोर्शन होंगे और पेशेंट की बैकग्राउंड हिस्ट्री होगी, ही हैज गॉट सम शफल इनसाइड द फैमिली और सम रफंड विद समबडी एल्स. तो दैट वे और ईसीजी में चेंजेस हार्ट अटैक में भी नहीं आ सकते. बट यस, अगर कोई एंजाइटी, कई बार मिक्स्ड वाले पेशेंट्स भी आते हैं जिनमें हम एंजाइटी और हार्ट अटैक इमीडिएट नहीं आप डिफरेंशिएट कर पाते हैं, तो हम उनको एडमिशन सजेस्ट करते हैं, ऑब्जर्वेशन में रहने के लिए कहते हैं. और जो मैंने कार्डियक मार्कर्स की बात करी, उन कार्डियक मार्कर को सीरियल कराते हैं, आई थिंक एट एन इंटरवल ऑफ 6 to 12 hours, so that when 2 cardiac markers and 3 or 4 ECGs taken at interval of half to 1 hour apart, if they are okay, then it's fine. You can dispose it off at taking its anxiety type of thing, and the patient responds to anti-anxiety drugs.
Okay, so how does sleep quality and quantity affect heart health?
Yeah, that is very important. 6 to 8 hours of sleep in a day is very much important for, because what happens when a patient is depressed, he or she is not having good sleep, anxiety, there are a lot of fluctuations in the heart rate, and because of fluctuations in the heart rate, especially increased heart rate, it leads to release of a lot of chemicals inside the body, and that chemicals causes increases in the heart rate further. So it's a vicious cycle. More and more chemicals released, more and more heart rate increase, and more chemicals released, and less sleep is there. But you have to modify it with the help of these maneuvers like yoga and meditation, which have come up in a great way over the last decade or so. हमने लाइफस्टाइल मॉडिफिकेशन के बारे में बात किया, उसमें डाइट आ गया, right? Heart healthy diet, which we discussed out, consumption of fibers, moderation of alcohol, no smoking and all. Doing, if not 7, preferably 7, 5 to 6 days of moderate intensity kind of exercises. Do regular yoga and meditation, and de-stress yourself. And because I've come across a lot of activities. Sometimes in the past, societies, they have come up with a kind of activities like yogas, meditation, apart from सब creative activities. हर किसी आदमी की अपनी activities का होता है, sports इसमें indulge करते हैं, जिसमें ऐसे नहीं है कि अपने जॉब करके आए, डेस्क पे बैठे, या अपने देखा पेशेंट्स, डॉक्टर्स का भी है तो अपने चले गए. तो दे आर काइंड ऑफ एक्टिविटीज, बोलते हैं थोड़ा चिल करना, ऐसे नहीं कि अल्कोहल ही लेना जाके स्मोकिंग करना. तो बहुत ही मतलब अच्छा है. तो इसलिए डी स्ट्रेस इज द मोस्ट इम्पोर्टेंट. हेल्दी लाइफ स्टाइल, गुड एनवायरमेंट, एंड and as far as possible, you can reduce your stress a bit. Make good friends who can give good advices, and you can also give good. It's a mutual kind of thing.
So, what's
Yeah.
the biggest myth you have heard about heart conditions that you would like to bust?
जैसे कि एक ये परसेप्शन सोसाइटी में है कि हार्ट की जो ब्लॉकेजेस, एंजियोग्राफी आप ना कराएं, आप कुछ अल्टरनेटिव थेरेपी से काम चलाएं, और एंजियोग्राफी करेंगी तो स्टेंट डलेगा ही डलेगा। एक
अच्छा।
एक ये काइंड ऑफ मिस एक ऐसा चलता है, तो ऐसा नहीं है। उसमें मैं यही कहना चाहूंगा कि अल्टरनेटिव थेरेपी का भी अपना रोल है,
हाँ जी।
लेकिन आप अल्टरनेटिव थेरेपी को नेचुरल, जो इसका अप्रोप्रिएट ट्रीटमेंट है, या स्टेंट्स हैं, या ब्लॉकेजेस को रिमूव करने वाली चीजें, उनसे आप रिप्लेस नहीं कर सकते बेसिकली। तो आपको मोर साइंटिफिकली अप्रोप्रिएट मेडिसिन, अप्रोप्रिएट मेथोडोलॉजी फॉर रिमूविंग द ब्लॉकेजेस इनसाइड द आर्टरीज इफ इट इज देयर, बिकॉज ये लाइफ थ्रेटनिंग हो सकता है, वो करना चाहिए। शुड नॉट बी कैरिड अवे बाई डिफरेंट काइंड ऑफ एडवाइसेस कि मुझे स्टेंट भी नहीं लगा, मुझे सिर्फ दवाई से हो गया, दवाई दी, हमारी 4 दवाई चल रही हैं, आपकी 10 दवाई चल रही हैं। तो दीज आर काइंड ऑफ थिंग्स, देयर आर लॉट ऑफ पीपल, हर तरीके के पर्सन्स होते हैं जो हमें गाइड कर सकते हैं। तो आपको अप्रोप्रिएट तरीके से, साइंटिफिक तरीके से अपनी डॉक्टर से बात करके मेडिसिन लेनी चाहिए, और जो वो एडवाइसेस बताते हैं उनको फॉलो करना चाहिए। और ब्लॉकेजेस होती हैं, उनका अप्रोप्रिएट ट्रीटमेंट करना चाहिए। कोई भी ब्लॉकेजेस होती है, वो हमें नहीं लगता टिल नाउ कि कोई अल्टरनेट थेरेपी से वो सही हो सकती है। ये थोड़े मिथ्स हैं।
Okay, thank you so much for sir talking to us, and it was really an insightful conversation with you.
Thank you so much. Thank you so much.
We hope 2024 will be much happier and healthier for you, and you would be able to take care of your heart and health. Till then, keep watching Ritam.